when I went to the doctor and he said, if you don't stop smoking, don't stop drinking, you need to exercise and stop eating garbage, you're not going to live long. And that, for some reason, that's what clicked for me to start making more changes, not just in the responsibility or irresponsibility of substance use, but the responsibility of recovery in a holistic sense, where I needed to take care of my body, and my mental health had not even occurred to me at this point, and it didn't actually for probably another 6 or 8 months. So I started eating cleaner. I was 230 pounds at that point, and I lost probably about 50 pounds in 8 months. I started going to the gym 3 times a week, and I knew nothing about working out. I was never athletic my entire life. I've never.
Thanks for tuning in to the Elevation Recovery Podcast, your hub for addiction recovery strategies, hosted by Chris Scott and Matt Finch.
Welcome, everyone, to the Elevation Recovery Podcast. I'm Chris Scott. We have a really cool guest today. His name is Zack. Zack is a personal trainer, certified personal trainer, and also an addiction specialist. Zack is in Mansfield, Ohio, and he first reached out to me, and we had a conversation on the phone about how he's been helping a lot of people in his kind of local situation, an outpatient type of situation that he wants to get started out there. I wanted to have Zack on the podcast to talk a bit about his story. He's a very interesting guy. So Zack, thank you for being on the show.
Thank you so much for having me.
Yeah. So as I've said a couple of times now, so I failed to press the record button the first time we started here. We got our conversation started early, and then we started again. So now let's go back to square one, because I haven't asked you, how did you discover alcohol? What was it like when you first started drinking, and how did your addiction or dependence unfold?
Yeah. So I didn't really start drinking until I was in my 20s, heavily. I experimented in typical high school parties, smoked a bunch of weed in high school, but didn't really get involved with alcohol or any heavy drugs until I was in my 20s. So I did fairly well in high school, though. I did have a rough bunch of teenage years. I came from a blended family, and I was just an angry kid, just an angry teenager. But I managed to get through high school. I graduated with a B minus average, I guess. So did okay. And then, but I've been playing music for my entire life. I guess, that carried over. I don't know if I really intended to, but it was easy enough for me to go from high school to immediately starting to play in the local nightlife circuit, the bar scene. And so being around alcohol all the time and other people that were drinking very heavily, I just started getting involved that way. But I didn't really comprehend at all the propensity of how much I was really drinking. And so I think it just started to progress. I think after I guess I skipped that part. I got married when I was 20, and have a daughter. She's 13 now. But we didn't stay together very long, and I was really immature and selfish. But she, we ended up splitting. And then after we split, I really started drinking pretty heavily and playing a lot of music because I didn't have any real things holding me accountable at home. So it was just me. So I started playing music full time, joined a regional band that was sponsored by Jägermeister. Regional means pretty much traveling states that connect with your state. So, and then from there, was there for a couple of years, and then joined another band that was more national. And I was on the road all the time. and drinking every day at that point, because I was touring. I was on the road every day, and I was going to bar to club to bar to festival. I played all kinds of really amazing festivals. I've been in 48 states other than Alaska and Hawaii. And I don't remember most of it, to be honest. It's all a blur. Like I know Matt Finch lives out in California there, and I played a week and a half in California and remember nothing of it. I remember going to Modesto and playing at a place called Fat Cats, and then somebody inviting us to an after party where I got so strung out, I was blown out of my mind for 2 days, and I woke up in a strange place in another state, and I didn't even know how I got there.
Oh.
But like that was typical of that time in my life. I had some really scary things happen, just overusing, and a couple of life-threatening situations that I didn't, it's just what I mean, I guess, between alcohol, poisoning, and just using way too much cocaine, things where like, it was just really scary. I thought I was going to die. But it was 2015, almost 2016, when I decided to leave that life, and I went home, and I came home to Ohio and left that band, and started to consider, at this point in the contemplation, for talking about readiness for change, the contemplation of, this is really bad. Like, this is a really bad situation at this point. And I had met a girl shortly before wanting to leave. So she was part of the reason I wanted to come home, because I was madly in love with this girl, and at least I thought I was. And I came home, but nothing really changed in the short term, because she was also a drinker. My lifestyle didn't really change because I lived in a bar. But at the same time, I was offered this really great opportunity. A buddy of mine, I was looking for a job, and he asked if I wanted to go work at a residential treatment facility for youth. And I was like, that sounds terrible, like babysitting kids. That doesn't sound awesome at all. And but I needed a job, and he sold it really well. So I ended up going and applying, and the owner of that facility hired me, even knowing he didn't know, obviously, at the time, but I was still struggling pretty heavily with drinking several days a week.
That's a first. I don't think I've encountered anyone yet who has told me that they started working in the rehab or recovery industry before they had any epiphany of their own. You just got a job there.
Yeah, well, and they're a residential treatment facility for at-risk youth. So a lot of it's behavioral, not necessarily drug and alcohol. Okay. So I didn't correlate the two. But while working there, I did start to develop a passion in working with people. I've started to find purpose in a sense. I started to find purpose in working with people, and primarily kids. I started really enjoying working with these kids, because they were going through things that were so much worse than I ever could potentially imagine. So I worked there for about 4 years, and in that time, I really did start to work on trying to live more responsibly, and but it still at that point had not clicked for me that I needed to be sober. At that point in my mind, I'm still going, well, I just need to not be an asshole about it. I need to just be responsible and do the normal drinking thing. I need to be able to drink like normal people. So I spent a long time in that, where, and eventually it didn't work out, because there were still times where I'd go on a bender, and I would still get triggered to use cocaine, because it was just something that eventually in my 20s happened, where it was just synonymous. Once I hit a certain point of drunk, I needed a stimulant to pull me out of that drunk so I could keep drinking and keep the party going, because that was my thing with binging, is I just never wanted it to end. I just wanted to stay in that moment and stay drunk and high and around people and have this amazing time and have all these amazing conversations where my brain's firing on all cylinders and I feel super creative. And, obviously, inevitably, that night ends and you wake up the next day, if you slept, feeling like you got hit by a truck. And that lasts for several days. But, I guess I digress. But so her and I ended up breaking up. And at that point, I couldn't afford the house I was in. So I ended up moving back in with my parents. And God love them, man. They put up with me for all these years. And I can't imagine all the stuff that I put my parents through with being worried about me being on the road and the substance use. But they were gracious enough to let me back into their home. And at that point, I started to get a little bit more mindful. And actually that happened I went to the doctor for just a checkup. I wasn't feeling well. The doctor ran blood work and things like that. My liver enzymes were just all over the place. They were considering the idea of me having hepatitis, potentially alcoholic hepatitis. I tested negative for Hep C, which was good. And I'm really surprised with as many crusty dollar bills has been up my nose and pipes have been in my mouth. And, I was never an IV drug user, but how I never actually ended up with hepatitis is by the grace of God, I'm guessing. But that's when I started to when I went to the doctor and he said, if you don't stop smoking, don't stop drinking, you need to exercise and stop eating garbage, you're not going to live long. And that, for some reason, that's what clicked for me to start making more changes, not just in the responsibility or irresponsibility of substance use, but the responsibility of recovery in a holistic sense, where I needed to take care of my body. And my mental health had not even occurred to me at this point, and it didn't actually for probably another 6 or 8 months. So I started eating cleaner. I was 230 pounds at that point, and I lost probably about 50 pounds in 8 months. Started going to the gym 3 times a week, and I knew nothing about working out. I was never athletic my entire life. I've never been, and so I didn't know how to start lifting, but I got on YouTube and I started figuring this out because I was too proud and egotistical to ask anybody for help. So I started working it out myself, but ended up injuring myself the first year. I have this huge, I won't be able to show you, but I have this huge scar on the back of my head from when I was doing pull-ups, when I shouldn't have been doing pull-ups. My hands were sweaty. I was on a high bar. I kipped, tried to swing my knees up, and I lost my grip and I fell backwards, slammed the back of my head on a weight bench, on the foot of a weight bench, and like blew open to my skull.
It's probably on YouTube somewhere if someone had their phone. Yeah.
Luckily, it was a small gym, and there was like
one
good guy there, and he was with me.
That's scary, though.
Yeah. But it didn't stop me, though. I healed up, and I started getting back. I got right back into it, and from there, it was a few months later, I really started noticing that my body was feeling better, and things were starting to click for me. So I just through research, I started getting into fitness supplementation and multivitamins, a multi-array of vitamins, I should say. At that point, I wasn't taking a multivitamin. I had 27 bottles on top of my dresser of all the different vitamins that I heard were good and I should try. And I still have, you can see it right there. There's a bin on my bookshelf of all the vitamins that I don't take every day. And some of those are recovery based. And actually some of those are based on videos that I've watched of fit recovery. So things I've tried. So I went out to Vitamin Shop and I bought them, like DLPA, glutamine, things like that. And those are all based on your recommendations. So I really appreciate
stuff. Yeah. Did you find that any of the supplements like really worked for you? Or was it kind of a slow, long process of repairing? Because it sounds like you were in a pretty bad state but at least like me, you found the gym, which
Yeah.
for me, that was the first thing. I called the gym my relapse barrier. That was my term for it when I was in early recovery, just out of detox. I was like, this is the only buffer that I have between me and becoming actively addicted, which I'm pretty sure could have happened quickly back then. And then I found the supplements, and it felt like I had just additional barriers and buffers, not necessarily even towards drinking again, picking up and drinking, but a barrier to becoming actively addicted again if I were to have a slip and pick up drinking, which I think there is a difference between having a slip or, if your goal is abstinence and you drink, that's a slip. It all depends where your goal is. Now, if your goal is abstinence and you drink and 3 days later you're still on a bender, I would say that's a relapse into an active addiction. You're in an active state of addiction. So the barrier towards both of those things, slipping or relapse, seemed to me to get bigger the more I repaired my body.
Right.
Yeah. So for you, I might have lost the initial question there. Did you find that there was anything specifically in those supplements that might have helped? I know it's hard to pinpoint exactly because you're taking a bunch of things at once. But for me, DLPA was super helpful. L-glutamine was super helpful. But then again, I discovered these on a piecemeal basis, and I'd add in one at a time. A lot of people who watch my videos or join my course or whatever, they'll take a bunch of stuff at once and they notice they feel a bit better over time, but it's hard to figure out what did what.
Right. I think that L-glutamine, because I didn't have alcohol cravings per se, but I definitely noticed in muscle recovery, because that's something that I hadn't really considered. I was using, creatine monohydrate or things like that, trying to eat high protein, but there were some days I was just really, really sore, but the L-glutamine seemed to help with that. When I started, and the other thing with L-glutamine is I did notice I felt more relaxed. When I started taking that for like a week at a time, I would kind of cycle it as needed, but I noticed I was getting better sleep. Because being a GABA building block, I guess, but so I did notice I felt a little bit more sedated, but in a good way.
That's common. Yeah. Cool.
Yeah. So yeah, that was a great one. 5-HTP was very helpful too, because I do struggle with, and I think it was, I don't know if it was before I started using, but I certainly know that it's after, I deal with some kind of acute depression, some situational depression at times, when things start to feel like they're coming off the rails in life. When I'm out of my routine, I start to notice that I don't have as much motivation, I guess, to do the right thing. I want to do what feels good, and I start to kind of travel back into that. 5-HTP seems to keep that level. So when I do start to feel like I'm coming off a little bit, I'll throw that back into my stack and take it until I don't feel like I need it.
Awesome.
But
that's cool. Yeah, I have like 6 medicine cabinets filled with supplements. I guess the only consolation now is I get to expense them to fit recovery whenever I try stuff. But I like to think of it as an insurance policy against something going wrong. If I have a phase where I'm getting horrible sleep, or I flew to Europe a few years ago, not since COVID, but I was trying a supplement. I was trying high dose niacin, which can be great for helping people recover from addiction. At this point, I'd already recovered, but I was seeing what it would do. I didn't anticipate a side effect of a blood sugar decline, which can happen with very high doses. So I couldn't eat on the plane, and I had like a low blood sugar episode because the plane served a dinner and I didn't want it because it was all processed garbage. So I'd taken this niacin, I got a low blood sugar episode. And so I actually had to I had to get my other bag out of the bin and get the L-glutamine, because I knew the L-glutamine would get synthesized into GABA and calm me down, and I also into glucose without causing an insulin spike in my brain. And that kind of fixed my little trial and error thing there. I decided not to do I didn't need the high dose niacin. I just wanted to take it myself before doing a video or anything else about it. But it's nice to have things that you can experiment with. And these things tend to be pretty benign. And over time, sometimes things, you find that you don't need something. I don't think I've taken 5-HTP in several years, but it was really helpful for me in early recovery. I reached a point where if I took a 5-HTP, it would make me uncomfortable, not feel horrible, but I would feel it would make it harder rather than easier for me to go to sleep. And that's because, in that case, excess serotonin symptoms can mimic too little. So I had enough. I didn't need to top it off anymore. So there's an annoying amount of information that you have to figure out for yourself, but it's a really cool adventure because you get to better yourself and you get to figure out what all these puzzle pieces are.
Yeah, and I didn't realize, I guess, and that was the kind of where I'm at in my recovery at this point is, and where I've been for the last, 18 months, 2 years is I got really obsessed with learning. I got really obsessed with knowing things. And so I've gotten to a point now where I know a little bit about a lot of different things, and my girlfriend, it's almost like it and there'll be all kinds of things that she'll ask me about and I'll know a little bit, but, and now I'm just her go-to, like an encyclopedia or something. Because I read a lot and I research a lot of things, and being in a field where research is king. We try to, whether it's fitness or recovery, we're trying to constantly learn about how it adapts, how it's subjective and objective, and so I've gotten very studious as far as wanting to stay a student in that. And actually a book that's really helped me with that I'm reading again right now is Ego is the Enemy, Ryan Holiday.
I'll have to order that. Yeah.
Oh my gosh, such a good book. I've definitely started to embrace stoicism as a philosophy of life, and it's, and I even in my recovery, I think my ego has tripped me up, because, I teach groups, I teach clients. So a lot of times I'm the teacher. So for a while, I got away from my own recovery, and because I was spending so much time in everybody else's recovery that I was working with. So I started becoming less introspective about what I was feeling and where I was at. And because it's almost one of those things where it's like, you feel like I've heard you talk about it several times, where is there a way to recover and not have to live under the umbrella of recovery, your whole life and be stigmatized by that. But, and I don't know if I'm there yet, but I think that I'm well on my way. But I think that there was, a few months back where it was just like, because I'm a clinician, I'm an addiction specialist. I'm working in all these other people's recovery. I must already have it figured out. So
7 years after I quit, and that for me, I say I transcended addiction. I say I'm recovered. I don't say I'm in recovery. However, addiction and recovery, to whatever extent those terms even make sense as entities, are the most complex phenomena I've ever studied. And to this day, one of my favorite things is I'll read a book that, got a lot of good reviews or that someone recommends to me about some aspect of addiction or recovery. And then I'll read a book with a similar number of reviews and someone else who I respect recommended to me that has the opposite premise. And it's so interesting to me. Right now, I'm reading a book called The Freedom Model, which actually deconstructs addiction and recovery to a level that even makes me mildly uncomfortable. And I've gotten to the point, one of my favorite books on the topic is The Biology of Desire by Mark Lewis, who's I think neuroscientist, PhD, and he deconstructs the whole disease concept, concludes it's not a disease, but that doesn't mean it's not serious. The Freedom Model seems to posit that we're dealing with a belief system. And I find it interesting. I like to read things with an open mind, because obviously my whole thing is that there is at least some element to addiction that is a biochemical disorder. I truly believe that. If that were the case, then supplements wouldn't have done anything for me or for anyone else.
Right.
But I think there's so many books that have part of the puzzle And none of them, including mine, have the entire puzzle, but we're all working towards figuring it out. One day, my hope is that some AI algorithm, hopefully not one that wants to take over the world and kill us, but hopefully an AI algorithm figures out everyone's addiction or makes it easier to be like, hey, you need more sunlight. And you have X, Y, and Z beliefs that are causing your subconscious autopilot to steer you into a liquor store, and they're just excuses. You need to explode them, get rid of them. And this person, maybe they drink because they don't want to face some trauma. And, we don't make choices in a vacuum. So if the mind thinks, well, I get to face the trauma and cry all night, or I get to go out to a bar and party, it's going to choose go out to a bar and party every time. So to what extent it's all psychological or biochemical or environmental or whatever is something that I haven't figured out. But I love trying to read opposing points of view and balance things, kind of synthesize things that are maybe even logically incompatible. It's a fun exercise for me to do because I know that the truth is somewhere in one of these resources, or a little bit from all of them. I'm not God, so I don't need to know the entire truth, but it's a fun adventure to figure out everything that I can, so that with the goal in mind of helping the most people. So, you kind of, as an addiction specialist, I'm sure you go on this personal evolution. You try not to tell people what to think, like in a dictatorial way, but maybe if you can lead people into a similar adventure of self-discovery, maybe that's the whole point.
Yeah, I definitely think that they're, in that sense, and that's something as far as that goes, it's the best recovery is Socratic. I guess the best way to be supportive in someone else's recovery is Socratic. So allowing them to come, make it their idea, that way, because almost anybody that I've ever met with an addiction problem or a maladaptive behavior with substance use also has an authority problem.
That is a very important point. Yeah. And I was thinking just the other day, how many people enter a treatment program or they're court mandated to go somewhere where they're
99% of my clients.
Yeah. And they're told, once they're in a top-down approach, very often, here are the things that other people have figured out for you. All you have to do is swallow the conclusions, but it doesn't work that way. It's like trying to take a test where you've had someone feeding you the answers to your calculus problems for the last 3 months, and now you go take the test and see if you pass. You're not going to, because you don't know how to work it out for yourself.
Yep.
Yeah.
That's the biggest thing is and I think that's definitely a big problem with faith-based conventional 30s model treatment programs is it's very much let me tell you how to live your life. If you don't like it, too bad, and or this is the only way it's going to work, and I think that there's definitely, with the traditional approach to recovery treatment in most outpatient programs, that's why we see the 85 to 90% recidivism rates, the relapse rates, because it's not a one size fits all, and that's definitely what's brought me to the place where at this point, and I won't say what agency I work for here locally, because they're great people. They really are. My boss gave me a great opportunity to start to be the program director for a drug and alcohol for the youth demographic, and with very little college education, so he gave me a great opportunity. So I won't say anything bad, but what I will say is what I disagree with, and the longer I've been in outpatient drug and alcohol treatment in that wheelhouse, the more I've noticed that it's a very broken system, a very weak approach to a very, very serious problem. When we talk about, the opioid epidemic, not just alcohol, but all these other drugs, it's most of what's being done, if not all of what's being done, at least in my area of this part of Ohio, is talk therapy, or a medication assisted therapy, or a combination of the two. And that's what they consider to be holistic. That's what medication assisted therapy and talking about your problems is the holistic treatment. It has nothing to do with biochemical restoration. It has nothing to do with, making sure this client goes to a doctor and gets a physical, and where that doctor specializes in being able to track nutritional deficiencies, or looking at negative biomarkers that could indicate neurobiological deficiencies. There's none of that being done here. And my goal with Level Up Fitness and Recovery Solutions, which we haven't really talked about, but I'm kind of segueing into it, I guess. But, so I'm currently in the process of designing a treatment program locally to here that, and this was interestingly how I found Fit Recovery in a big way, was I was looking for evidence-based solutions that revolved around fitness and nutrition as a means of creating the foundational groundwork for recovery, creating a really strong foundation, the pillars of it, because I knew at this point that addressing the belief systems or the psychological problems of someone that's struggling with a substance use problem isn't the answer when they're going through acute withdrawals, they're detoxing, or they're even in early recovery where post-acute withdrawal is a serious problem. When they're still living in the same terrible social environment, the recovery environment's awful. When the body feels terrible, we're going to look for a way to not feel terrible. And unless you know that if I eat these things, it's going to do A, B, and C in a good way, or if I eat garbage, it's going to do A, B, and C. I'm going to be inflamed. I'm going to feel lethargic. I'm going to feel depressed. And if I'm not getting enough protein, I'm not going to have the essential amino acids that I need to produce the chemicals in my brain to help me cognitively function, not feel like shit, and et cetera, et cetera. None of that's being addressed. So I knew that the blueprint here, and in many places, I know, is wrong. So being able to find a much more structural blueprint that we can build up off of. It's not that 12-step programs are wrong. It's not that conventional talk therapy is wrong. It's timed wrong.
Yeah, that was very, very well said. And I think with the problem in which with a problem that consists of putting bad things into your body, you would think that the solution would involve being very careful and deliberate about what you put into your body.
We look to escape. We want to escape it. It's an escape. It's an escape skill. Our skills are an aversion to pain. I hear Matt Finch talk about it a lot, a negativity bias. Mm-hmm. Bad feels worse than good feels good.
Right. And we don't make decisions in a vacuum either. We don't make choices in a vacuum. We have alternatives. So, there's a little bit of belief there. But I mean, to me, I was such a zombie for literally weeks or months, lessening degrees of zombie as time went on, mostly thanks to biochemical repair, which I did in a piecemeal fashion. But I didn't know what the hell was going on. I needed to be restored to some semblance of not being just a mindless automaton in some ways, which I was at the very end of my addiction.
But how does the average Joe, I guess, and I'm asking you the question, how does the average Joe get to the place before it's too late? And I do think that there is a place where it's just too late, but how does a person get to a place to seek out this information? Because I think you and I, people like you and I, tend to be the exception to this. We hit such a place where we're just like, there has got to be something better. We rebel against what we're told, and we try to look for an alternative because of our authority problem, maybe, but the services that we try to provide, because I think that this really what we're talking about is service. It's service to people, and in the most effective way possible, to be eminently as effective as you can. So being able to recreate that blueprint, how does a person figure that blueprint out for themselves when they've never been told eat clean, make better choices? All they've ever seen their parents do, or anybody in their social circle, all they ever see them do is use drugs or drink to escape whatever feeling they're feeling, whether it's physical, emotional, whatever the case.
It takes time, I think, for culture to change. I know it takes time for the medical establishment and scientific establishment to welcome new information. I mean, I've interviewed Julia Ross on this podcast, who's a pioneer in amino acid therapy. I interviewed the son of the late Joan Matthews Larson, who wrote a great book, 7 Weeks to Sobriety, about nutrient repair for alcohol addiction. And, these people did their best work in the 80s, and it still hasn't infiltrated into the mainstream. I have noticed some good signs in that there's at least a lip service embrace of this information on the part of certain treatment centers. There are a few more doing it than before, which is good. I spoke to the founder of Inner Balance, which is in Loveland, Colorado, I believe. Very interesting guy. That was in a previous episode. And they do biochemical repair there, just like the HRC, Health Recovery Center in Minnesota, does. There aren't that many, but treatment centers have started at least writing articles about it because they have to. The reason they have to is that people are searching out this information. So the somewhat insidious thing that often happens is that someone types in to Google vitamins for alcohol withdrawal or whatever, and they end up on a rehab website that wrote an article about that, but then funnels them into their talk therapy based approach, 100% talk therapy. They might not even offer medication assisted treatment. It might be 100% talk therapy. And some of the worst ones, now there are some good ones out there, so I don't want to paint the whole rehab industry as bad, but I think there were some lawsuits a few years ago against a giant rehab chain that wasn't even treating people for withdrawal. Some people were dying in their beds. So it's an overall ugly picture with some signs that they will have to get better. And, my goal is to just try to reach as many people as we can. I think it's really helpful to have people like you working in your local communities, because the more, I don't want to say grassroots, it's not a political campaign, but the more people we have on the ground talking about this stuff and getting the message out and offering services, I think the more people are going to benefit from it. And, selfishly, my whole mission from the beginning was to help 1 million people. I want Fit Recovery to reach 1 million people and help them not go through the worst phase of what I went through. So, because I really think that even though I did end up hitting rock bottom in a real AA type of sense, if someone had come to me with the information about biochemical repair and some of the other things that we discussed, the biopsychosocial spiritual hierarchy, if they had just given me a little pamphlet or sent me a PDF file or an ebook or whatever, a year before I quit drinking, I really think I would have quit at that point, because I would have felt like I had an option to do something differently.
Yeah.
So it's cool that you were able to start making changes before you were aware that things existed in this realm. It's even cooler that you've taken it upon yourself to figure it out. It sounds like you were in a very similar mindset as I was when I was like, there has to be something else here.
Yeah. Yeah. I mean, I think so too. I think you and I are definitely on the same page with that. It's just, and because I, when I, at 27, when I got out of the music scene and found that job at that residential, that's when I found a passion in working with other people. So it was, so this has just carried over into my recovery has, my faith in God is strong. So I do think that this is why I survived all of the things, and being able to reach out and help other people address their problems in an effective way is my life's mission at this point. And I want to be able to do that as with with the most effective strategy as I possibly can. And the most effective strategy that I'm finding is starting from the ground up, physiologically, psychologically, socially, spiritually, and then in that order, and I guess some of those do intertwine and they do work together. But, definitely, if, I've had multiple clients that I've made recommendations for various supplements, and they have been able to describe their this season of their recovery as something entirely different than they've ever experienced, because they physically feel better. They're walking a couple miles a day. They're taking a really strong multivitamin, which I use, Microfactor First Form. I know you've talked about Triumph with Legion, and I've used that one too, and that's a great multivitamin as well. But a good multivitamin and a couple of essential aminos that I'm pretty much recommending across the board for anybody in whatever scope of substance use they're in. Like I have one female that's been using crack for a long time, and she's been taking a multivitamin, walking a couple miles a day, and taking 5-HTP to help her mood and some DL-phenylalanine, and she's done better. And she's relapsed 8 times since I've been working with her, and she's still going strong, still doing really well as we're talking today. She's still got a lot to work through socially in her recovery environment, but right now I can notice a marked difference in significantly how she's acting, just by her physical behavior, I guess.
Yeah, that's amazing. So for where you are now, you seem like similar to Matt Finch. You've had a big transformation from being, very addicted, playing in a band at one point. Both of you have that in common. I think I want to facilitate a discussion between you two, because I think that would be really cool.
That'd be great.
Well, like when you wake up in the morning now, I assume you're in a much different place than you were when, the doctor told you that you had to make changes because you weren't going to live long. So that's a fear motivator. Then I was initially motivated by fear. I didn't know if I had cirrhosis. I didn't know if I, whacked my brain. I felt pretty weird. But eventually there was a shift from fear to forward-oriented excitement.
Yeah.
So do you find that that's the case now? And if so, it sounds like you do. Like, what are the kinds of things that you think about when you get up in the morning or that excite you?
Right now, I'm kind of reinventing my morning routine. I found that I comfortably get up between 5 and 5:30 every day, and most days I'm excited to get up out of bed and get to the gym. I've recently taken on trying to learn how to meditate intensively, I guess deliberately. I've never been very good at meditation, and because I feel like every time something comes into my head and I lose focus of my breathing or whatever, I feel like I fucked it up, and now it's like, nah, I might as well stop.
I'm the same way. Yeah. I've actually never met anyone who told me they're great at meditating. And if I did, I don't know if I would trust them.
Yeah. So I've been using the Headspace app, and that's a really, really good tool because they have a lot of really great tutorials in there. But really just expressing gratitude. But I guess to answer your question, I don't live in fear anymore. Now I live in a place of hunger. I'm driven and hungry every day to push myself to be the best version of myself, because I really, really think truly that recovery is defined as us creating a life and an identity that we want to be present for truly, and not feel the need to escape from. And that's really what my recovery has become. I'm constantly cultivating things in my life that I want to be here for, and not in an altered state of mind, in my full self, and not want to escape. But also when I do feel those feelings of wanting to not be present, that I'm looking for real solutions, real tangible solutions, and not a means to escape temporarily or whatever immediate gratification I can muster.
That was really well said. I'm excited. We're going to have some great snippets from this interview with you. And I'm excited to have you on the show again. I'm really happy to hear about the things that you're doing in your community. And, I'm excited about some future collaboration. We'll make sure to have you back, as I said, to talk to Matt. But people can really benefit from hearing about your story and also the work you do with clients. So I really appreciate your time.
I really appreciate you having me here.